Hey everyone, welcome back for another deep dive. Today we're tackling something that hits close to home for many of us, especially our expectant parents out there. It's hypertensive disorders of pregnancy.
That's right.
We're going to break down what the research says, what it all actually means, and why it matters for you. And to help us do that, we're turning to a great article by Doctors Coggins and Lay. It's packed with insights, so let's dive in.
It's interesting you say that because I think a lot of people don't realize just how dangerous these disorders can be. We're talking a leading cause of illness and even death for moms and babies globally.
Really, I knew it was serious, but that's a whole other level.
It is. To give you an idea, here in the U.S., these disorders affect something like 5% to 10% of all pregnancies.
Wow, so we could be talking 1 in 10 pregnancies right there. Okay, so before we go any further, let's make sure everyone's on the same page. When we say hypertensive disorders, what exactly do we mean?
It's not just one thing, and that's where things can get a little complicated. There are four main types: chronic hypertension, gestational hypertension, and then there's preeclampsia, eclampsia, which always sounds a bit intimidating.
It does have a ring to it, doesn't it?
And then we've got chronic hypertension with superimposed preeclampsia.
Okay, so 4 main players, each with its own quirks. But before we break down each one, can we say that, in general, any high blood pressure during pregnancy is a cause for concern?
Absolutely. Even if it's not quite at the level of a formal diagnosis, even slightly elevated blood pressure can increase the risk of problems. We're talking about things like premature birth or babies being born with low birth weight.
So it's kind of like even a blip on the radar means doctors need to pay close attention.
Exactly. Always better to be safe than sorry.
Mm.
So with those four types,
Let's start with chronic hypertension. I'm guessing this one's the, I've been dealing with this for a while, kind of high blood pressure, right? Even before pregnancy.
you got it. Chronic hypertension is there before a woman gets pregnant or shows up before that 20-week mark. And here's the thing, even if it pops up during pregnancy, if it sticks around for more than 12 weeks after the baby's born, it's still chronic hypertension.
So less about when it happens during those 40 weeks and more about whether it's a long-term issue. Got it.
Exactly.
Yeah.
And within chronic hypertension, we've got two main culprits. Primary hypertension is the most common. It's a bit of a medical mystery because we don't really know what causes it.
So it's like the common cold of high blood pressure. Everyone's got theories.
Pretty much. And then you've got secondary hypertension, which is less common. But this one's easier to pinpoint. It's caused by something specific going on in the body. Could be kidney disease, hormonal disorders, even certain medications.
Like those detective shows where it's obvious something is causing the problem, it's just a matter of finding the culprit.
And that's why that medical history is so important to figure out the why behind the hypertension. Knowing the type and how severe it is helps determine the risk for mom and baby, which, speaking of, leads us to gestational hypertension.
It's like the sequel, right? But instead of showing up fashionably late, gestational hypertension waits until after that 20-week mark.
Precisely, after 20 weeks, but the good news is, most of the time it goes away on its own within 12 weeks after the baby is born.
So a temporary house guest. A bit disruptive while it's there, but eventually packs up and leaves.
Something like that. But you can see how it might get confusing. If a woman hasn't been getting regular checkups before pregnancy, telling the difference between chronic and gestational hypertension can be tricky.
Ah, so it's a was it there all along kind of mystery.
Exactly. And just like with chronic hypertension, gestational hypertension has a range from mild to severe. And those severe cases, well, those come with a bigger risk of complications.
Okay, on to preeclampsia. I've heard other moms talking about this one, and it always seems to be surrounded by this air of, you don't want to mess with this.
Yeah, no, it's definitely one we watch closely. Preeclampsia is serious, usually shows up after 20 weeks, and it's kind of a double whammy. You've got new onset hypertension, so the high blood pressure wasn't there before, plus at least one of these red flags, like protein in the urine, what doctors call proteinuria, or signs that other organs aren't happy.
So it's more than just the number on the blood pressure cuff, it's the ripple effect it's having. And speaking of, when we say other organs not being happy, what are we talking about? Give me an example.
Well, we're talking about things like your vision being affected. And I don't mean needing reading glasses. I mean like suddenly seeing spots. Blurry vision, that's not something you can ignore.
Oh, wow. Yeah, that's not your average pregnancy symptom.
Not at all. Or it can be things like your blood platelets, which are essential for clotting, being affected. Your liver, kidneys, preeclampsia can really mess with how well those organs are working.
Serious stuff.
And it can get even more serious. We were talking about how preeclampsia is serious. Well, HELLP syndrome is like the emergency siren is going off.
Okay, so HELLP syndrome sounds like preeclampsia is like really intense cousin. What makes it so concerning?
Well, basically, with HELP syndrome, the body's own cells start to break down. Red blood cells get destroyed, liver enzymes go haywire, platelet levels plummet, which can cause serious bleeding problems. And you know how crucial the placenta is for the baby's growth. Well, HELP syndrome can disrupt its function. Obviously, that has huge implications for the baby.
And for the mother, too.
Of course, it can be life-threatening for the mother as well.
This is heavy stuff. And then on top of all of that, there's eclampsia, which takes things to a whole other level.
Yeah, eclampsia is basically when preeclampsia progresses to the point of causing seizures. And what's scary is that it can happen really without much warning. One minute things seem fine, the next minute, boom, a woman's having a seizure.
Definitely not something you want to wait and see if it gets better on its own.
Exactly, and that's why catching and managing preeclampsia early on is crucial. Eclampsia is incredibly risky, both for mom and baby, with the potential for long-term health problems, even death.
So those intense headaches, sudden vision, changes its go time straight to the hospital.
Absolutely, no question about it. Better safe than sorry.
Couldn't agree more. Okay, last but not least, we've got chronic hypertension with superimposed preeclampsia. Sounds like those two got together to cause some trouble.
It's about as much fun as it sounds, really. Think of it this way. Imagine a garden hose with like a tiny little leak. That's your chronic hypertension. Now imagine someone cranks the water pressure up to the max, and suddenly that tiny leak becomes a major blowout.
Okay, now that's an image. So basically like adding fuel to the fire.
Exactly. Chronic hypertension with superimposed preeclampsia means this woman already had chronic hypertension, and then bam, preeclampsia develops on top of it during pregnancy.
Which, obviously, high stakes for both mom and baby. Way riskier than either condition on its own.
Oh, absolutely. We're talking much higher likelihood of complications, things like preterm birth, the baby not growing as it should, even placental abruption, where the placenta actually starts to detach from the uterine wall.
I'm guessing doctors are watching those cases very, very closely. But how do they even begin to untangle all of this? What are the signs that something might be off with a woman's blood pressure during pregnancy?
Well, I mean, the most obvious one is high blood pressure. We're talking 140/90 millimillo Hg or higher on those readings. But it's not just about a single high reading. We're looking for patterns. When did it start? Are there any other risk factors?
So it's like putting together a puzzle, huh? Doctors are taking those blood pressure readings, the mom's medical history, and then looking for any other clues to figure out what's going on.
Exactly. They'll want to know, like, when did this high blood pressure start? Was it already a thing before pregnancy, or did it pop up later? Family history of hypertension, any other health conditions, even things like age and weight, it all plays a role.
And I'm guessing a physical exam is a big part of that detective work too, right?
Absolutely. You can't underestimate a good physical exam. We're checking for any signs of organ distress, swelling, changes in vision, listening to the heart and lungs, reflexes, all that. It's all about connecting those dots.
Okay, so we've got the blood pressure readings, medical history, physical exam, and I'm assuming lab tests are a big piece of this puzzle too.
Oh, absolutely. Lab tests are key. Blood and urine tests, they can tell us so much. They can pick up on things like protein in the urine, which we talked about earlier, check those platelet levels, see how the liver and kidneys are functioning.
It's amazing what they can learn from a little blood and urine, isn't it?
It really is. And once they've gathered all the clues, they can figure out which type of hypertension it is, and just as importantly, how severe it is.
And you mentioned earlier that knowing the severity is super important for treatment. How does that work? Like, what's the approach for a mild case versus, say, a more severe one?
That's a great question. For milder cases, especially gestational hypertension, sometimes the best thing to do is, honestly, watchful waiting. And that doesn't mean ignoring it. It just means monitoring it closely, frequent checkups, making sure things aren't getting worse.
Okay, so like keeping a close eye on a simmering pot, you don't want it to boil over.
Exactly. But for the more severe cases, especially if we're seeing signs of organ damage, more aggressive treatment is usually needed. And that's where medication to lower the blood pressure comes into play.
Speaking of medication, is there anything that can be done to prevent these hypertensive disorders in the first place?
That is the million-dollar question, isn't it? We can't completely eliminate the risk, but there are some things that can help. For women who are at a higher risk of developing preeclampsia, taking low-dose aspirin early in pregnancy can be a game changer.
Really? Aspirin? You're saying that little pill can help prevent preeclampsia?
It seems surprising, right? But research shows that low-dose aspirin can actually help prevent those blood clots, the dangerous ones, from forming in the placenta, which we know is a big contributor to preeclampsia. It's one of those simple things that can make a real difference.
Definitely filing that one away. Now, what about treatment once a woman is diagnosed? What are the options there?
Well, the only true cure, so to speak, for hypertensive disorders in pregnancy is delivering the baby.
Which makes sense since pregnancy is part of the problem, right?
Exactly. But of course, we don't want to jump to delivery unless it's absolutely necessary. So a big part of treatment is managing those symptoms, keeping mom and baby healthy for as long as possible.
Buying time to give the baby the best start possible.
Exactly. And that usually involves watching that blood pressure like a hawk, being on the lookout for any signs of organ damage, and a lot of times medication to keep that blood pressure in a safe range.
I was just going to ask about that. So even if delivery is the ultimate goal, medication can help bridge the gap and keep everything in check.
Exactly.
What are some of the medications that doctors use for this?
There are a few common ones, and the specific choice really depends on the woman and her individual situation. But some names you might hear are labetalol, hydralazine, nifedipine, methyl-dopa.
Got it, writing these down.
And the good news is these medications have been well studied and are considered safe for both mom and baby.
That's good to hear. But as with any medication, open communication with your doctor is key, right?
Absolutely. No question is a dumb question, and your doctor is your partner in all of this.
Well said. This has been such an eye-opening conversation. As we wrap up, what are some key takeaways you want our listeners to remember?
I think the biggest thing is this. High blood pressure during pregnancy, it's not something to be taken lightly. It's not always an emergency, but it needs to be taken seriously and monitored closely by a healthcare provider.
And don't be afraid to speak up, ask those questions, advocate for yourself and your baby.
Exactly. The more you know, the better equipped you are to make informed decisions.
Could not agree more. Thank you so much for joining us on this deep dive. We've covered a lot of ground today. And listener, thank you for being here. Remember, you're not alone, and there's a ton of support and information available if you need it. Until next time, stay curious.